I'm Dr. Maynard. I'm a bariatric surgeon in Monroe, Georgia. I've been doing bariatric surgery for the last 20 years. A little bit about me. I was originally born in St. Martin, small island in the Caribbean that's half French, half Dutch. So we got to work a lot together to make things happen in a small space. Moved to the United States to do my undergrad in Tampa, Florida. Then I went on to Nashville to do my medical school. From there, came back to Tampa, Florida to do my surgical rotation, residency, and then went to Omaha and did bariatrics in Omaha. Following that, my wife and I moved to Atlanta, Georgia, where I started a practice in Rockdale, was there for about 11 years, and then moved to Monroe, Georgia, about 7 years ago, and that's where we've been. Bariatrics, I believe, is one of the few areas that you can impact a patient's life, not just their weight, but their overall life. You extend their life, you extend the quality of their life, you allow them to live their best lives. And that's the passion that I have for bariatrics. My initial encounter with overweight patients was a young 8-year-old boy who had Prader-Willi, who essentially was 200 pounds over his weight, that his ideal body weight, and all of the issues that brought to the table. This was very early in my training in medical school. From there, I saw that impact of being obese on individuals, where it would exacerbate their hypertension, their diabetes. Individuals couldn't climb a flight of stairs, couldn't sit on the ground and play with their kids. And once I encountered weight loss as a solution, weight loss surgery as a solution, it really allowed me to try to take this tool and maximize it to the benefits of all patients. And that's what I've been doing for the last 20 years. Our surgical care philosophy is all hands on deck. It's a total package. We look at the patient not just as a monolith of someone needing to lose weight, but someone really needing to try to live their best lives. And to do that, you have multiple components to that. When you undergo weight loss surgery, it brings a certain amount of stress to your life. And if you are dealing with additional major stresses at the same time, it diminishes your chances for success. So this is why we have most of our patients see a psychologist to make sure that they're not exacerbating stresses that are going on in their lives that will prevent them from having success. So for some people, it may be some marriage difficulties. For some people, it may be a direct eating disorder. For some people, it may be problems that's going on in their families with their kids. For some, it may be job-related stresses. And all of those things we need to have under some control in order to really tackle the elephant in the room, which is the excess weight. Once that excess weight starts getting under control, the same tools that you use to get ready for surgery and to be prepared for success is some of the same tools that you use to improve your education circumstances, to improve your financial circumstances, to improve your professional circumstances. And so what we find is a lot of patients, once they embark on this journey, they don't only take care of the excess weight, but they take care of tremendously all the other aspects of their lives that allow them to be successful over the long term. And this is the reason why we do this, is it allows patients to live their best lives. Is there a patient that's one of my favorites? Favorite stories? I think, yeah, we have a couple really good ones, but the one that really sticks out to me is actually a patient that I didn't operate on. A young man who I would call probably the healthiest 700-pound man I've ever met. And this gentleman came to us, did not have the support of family, and we had decided to do his surgery and get him ready for surgery. So by the time he, 8 months later, we had to send him to have his surgery in Omaha. He had brought his weight down to about 680 pounds. He was in tremendous shape. Went into surgery, should have been in the ICU for 6 days. 2 days he was out of the ICU after traveling 1,000 miles to Omaha. Came back to us a week later and has been in our program ever since. That gentleman is now about 280 pounds. It's been 15 years. This young man went from a tech assistant at night to now one of the top vice presidents of his company, traveling around the world selling, telecommunications equipment. So that's been one of those things where not just coming in and providing surgery, but really providing someone a pathway to tremendously improve their lives was successful, and he continues to be successful and an inspiration to us every day. I'm super passionate about bariatrics because one of the things my dad told me early on is if you love what you do, then you really never work. So every day you come to work basically enthusiastic to find the new thing, to find the next thing, to meet that new patient, to allow them to experience the success of the weight loss surgery that you're performing. Also to experience the overall aspects that improves their lives tremendously. So for me, the reason I'm passionate about this really comes down to people and allowing people to be their best selves, the best version of themselves possible. And so that's what gets me up in the morning and fires me up all day.